What?
Everyone makes mistakes, broken into a million tiny pieces on the floor, the only possession my mother had from her mother's mother. The teacup painted daintily with pink and purple flowers was forbidden to be used. I was grabbing a different cup from the cabinet, honestly, but in the process, I inadvertently smashed the teacup to the ground. I stared at it broken onto the floor. I felt so guilty. How could I have done that? I definitely did not want to get in trouble, and I didn't want to hurt my mother. So I did what any normal 7-year-old would do. I swept it up and hid it in the bottom of the trash. The days following the teacup's demise, I lived on eggshells, afraid of the moment my mom would find out. The guilt finally overtook me, and I confessed. To my huge relief, she said she understood how that could have happened, and we decided to move some of our other favorite dishes out of harm's way. We learned from my mistake and together made changes so it never happened again. I felt so empowered that I was helping to prevent future mistakes, and my mom, I knew, felt reassured that she could always trust me to tell her the truth. Most of us have probably had similar experiences. We made a mistake, and the fear of getting reprimanded or hurting someone made us want to hide in shame. Ultimately, it was only bringing the mistake into the light that calmed our consciousness. Mistakes are inevitable, and when we share them, we learn from them, and we help to prevent their reoccurrence. Perhaps like me, you've learned from breaking something that doesn't belong to you, or even from damaging an irreplaceable item. But now imagine that mistake you make isn't one that damages something, but rather a mistake that damages someone. This is a different story, or isn't it? If a doctor makes a mistake, her reputation and perhaps her entire career is on the line. Imagine the stress and the guilt. The pressure to be perfect, or at least appear to be perfect, is overwhelming. It is actually one of the most common causes of mental burnout in the profession. But now imagine a culture where, like in the family teacup incident, doctors can and will confess. They are encouraged to share their mistakes without fear so others can learn. Professionals work together to improve outcomes, like rearranging the kitchen cupboard to prevent more casualties. Doctors are human. They are going to make mistakes. The days of physicians and administrators covering up mistakes while silently hoping and praying that no one will discover the error and sue are far over. Culture is shifting to allow mistakes to be openly examined in ways that improve care and trust and foster trust between physicians, coworkers, and patients. Before we investigate systems that work, let's pause to think about the long entrenched system that did not. Just as the guilt and shame I felt for breaking the teacup ate at me, the expectations that physicians must be perfect takes a toll, not just on physicians' physical and mental health, but this expectation extracts a toll from patients and the economy as well. Of course, I'm not talking about gross negligence or intentional harm. No one should tolerate egregious carelessness in healthcare professionals and chalk it up as a learning experience. But even the most conscientious clinicians find themselves in circumstances where perfection is just not attainable. Brian Goldman is an emergency room physician and medical journalist. He reveals professional mistakes in the medical field are very common, yet few doctors will speak openly about them. Goldman has written a book documenting how unrealistic expectations create a negative culture in which physicians are tactically encouraged to hide their errors. The pressure to be perfect causes doctors to be reluctant to share their mistakes because they feel guilt and fear repercussions such as lawsuits or losing their license. This culture is not only stressful, it is tragic. According to research published by Johns Hopkins, medical errors are the third leading cause of death in the United States, just behind heart disease and cancer. Furthermore, physicians who are discouraged from sharing their negative experiences feel isolated and stressed. Researcher Dr. Claire Gerda reports that doctors have higher rates of depression and anxiety compared with the general population and other professional groups. Self-medication with drugs and alcohol are common, with the American Addiction Center reporting that the rate of prescription drug abuse among doctors is 5 times higher than in the general population. Additionally, doctors in the United States are 2 to 3 times more likely to abuse alcohol than in the general population. It is not a stretch to think that some of the factors contributing to this crisis are the feelings of guilt and low self-esteem that comes when things go wrong. I can still remember the anxiety, laying awake, wondering if my mom would find out about the broken teacup. I can only imagine the anxiety if what I had broken was a living person. Beyond their own psychological impact, not being able to share mistakes inhibits the rate at which other physicians can learn. When doctors are encouraged to share mistakes, new procedures or protocols can be developed. Just like reorganizing the cupboard to prevent more cup catastrophes, doctors should be empowered to work to prevent future errors. Another casualty of this wall of silence is the relationship between patient and doctor. At best, a mistrust, at worst, an adversarial relationship can develop when patients feel a doctor is not being truthful with them. Finally, malpractice insurance, and the resources used to engage in malpractice suits or mitigate mistakes is a multi-billion annual cost that is ultimately passed on to patients. With all this in mind, we might ask, is there a better way? There is. First, we need to revamp the medical malpractice system, which is currently based on an adversarial process. Denmark has a national no-fault program to compensate patients who have suffered from medical mistakes. This removes the adversarial component. Also, because the government is in charge of compensation, it removes the negative economic effects of malpractice insurance. This streamlined system provides patients with fast compensation and takes away the stigma and punitive aspects of medical mistakes. Of course, again, this system is for medical mistakes, not for gross negligence. Secondly, we need to foster a medical environment where doctors can learn from others' mistakes. We need to be able to have medical professionals work together to reorganize the cupboard. The Danish system maintains a national database to collect and analyze data to improve medical systems and allow doctors to learn. It's beneficial to see trends in repeated mistakes. Third, we need to improve doctor and patient transparency. This will promote communication and trust. Lastly, we must support doctors when they make medical mistakes, not penalize them. This can and will work here in the United States. In fact, some medical health systems are leading the way. For example, the University of Michigan Health System created a non-defense approach which highlights transparency, early reporting by doctors of mistakes, explanation to patients, emotional support for the doctors involved in the mishap, swift compensation to patients, including procedures to mitigate physical damages, and a team to analyze the adverse event to promote learning. And they are getting results. Medical malpractice suits declined, patients' results and safety increased, and doctors report less guilt and shame. But we can't have an ad hoc piecemeal approach. We need a culture change. We need the federal government to step in and step up to make changes. The federal government has created some resources for hospitals to create programs like Michigan's. Mainly the Candor, which outlines programs for responding to unexpected patient harm in a more transparent and constructive way. However, this is not enough. Modifying the medical malpractice system nationally and creating a way to keep, track, and analyze medical mishap data is crucial to improving patient outcomes. Breaking my mother's favorite teacup was definitely not the last mistake I've ever made, but it was one of the last times I kept my feelings and faults to myself. Sharing flaws with others is difficult on its own, but even more so when the flaws regard your career. The stigma around doctors covering up medical malpractice is ingrained into healthcare and is the norm. This is hurtful not only to doctors, but their patients, coworkers, and society as a whole. So we need to reorganize the cupboard and change the culture to promote communication, learning, and better health outcomes.